Well, it is that time of year. A lot of you have the sniffles. I know I work with a lot of people who have the sniffles. I myself have them. But are you sick? Could it be allergies? Talking to a lot of people, maybe they don't know. The good news is we have a lovely expert right here on Delmarva. I'm introducing you now to Dr. Amirneni with Beebe Healthcare. Thank you so much for being here today.
Happy to be here. Thank you for getting me.
Of course, of course. So you are an allergist with Beebe. You just started last month. We're so excited to have you on Delmarva, and this is part of a new practice on Beebe.
Definitely, yeah. We're really excited to expand, Beebe's horizon and start the allergy group there. And I'm very, very honored to kind of take that lead and start that branch. And so it's brand new practice. We're starting off and seeing patients, and it's very exciting.
It sounds very exciting, and it sounds well needed on Delmarva, definitely. So what kind of patients are you seeing? I heard you see a variety of people.
Oh yeah, so we see the main unique thing about allergy is we see patients of all ages. So we see patients from, right when they're born up to, 90s and even 100. So we kind of count the centennials that we're seeing. When we get that specialist allergist kind of label, we need to go through a specialist training. So after med school, if you think of, all the years that we spent in studies as a doctor. So after med school, you have to go through either internal medicine or pediatric training, and it's either or, and both of them can apply. And the way that you go in is after that you actually apply for like fellowship training in allergy and immunology. So you go through under specialist training for like the diagnostic testing, the treatments for allergy diseases, and the really unique thing is that we get the training on both sides of the spectrum.
I'm glad you mentioned that because I didn't even know there was kind of this other side. I always think allergies, I think pollen, or I'm allergic to dogs, for example, and kind of just those outside things. But that's interesting that you guys have so much knowledge about allergies as a whole.
Yeah,
that's incredible.
Yeah, and that's why we kind of say allergist, immunologist, because we kind of are a specialist of the immune system as well as the allergic diseases, which is what we're commonly known for.
Definitely. So of course it is cold outside, and when you think allergies, you might think spring allergies, right? Or the different seasons changing. But what kind of allergies are you seeing in winter? Can people get allergies in winter?
For sure, for sure. So essentially, that's exactly right. A lot of patients think of, the seasonal hay fever-like symptoms. You're sneezy, sniffly when the pollen is out, when the pollen count is high. But it is actually as common, if not more common, to have year-round or winter allergies as well. And the things that are more prevalent now, obviously, there's no pollen around. With the first freeze, usually most of the U.S., the pollinating trees don't pollinate anymore, so you don't have pollen laying around. So they can take a little bit of a respite for patients who have that type of allergy, but you're mostly in the house, you're kind of trapped indoors, for lack of a better way to say it, but you're getting all the exposure that is indoors. So the indoor allergens is what really cause the winter allergies.
Oh, okay.
Yeah, the most common is actually dust mites.
Oh, all right.
Yeah.
So we've got to dust our houses.
Yes.
Okay.
Yes. Obviously, regularly cleaning.
Yes.
A lot of the things that you may not think of, especially with the holidays, you have a lot of like irritants as well, in addition to allergens. So, like things like scented candles, or even certain types of fireplaces going. You have the smoke that can be coming, and it can irritate some of your nasal symptoms.
Wow, that's a lot that I didn't think of. I'm glad that we're talking to you today, because for some people, especially, I've had friends who, you guys probably know this too, do you kind of have that one friend that's just always has allergies? And you're like, do something about it. So when do you think people should start saying, okay, I don't have to be uncomfortable all the time, I should see an allergist?
Yeah, I would say if things are not getting better by using over-the-counter medications, or even when you're seeing your primary care doctor, they try a medication or two and it's still not getting better, and you really want to find the source of like, okay, what am I allergic to? What are the triggers? So that would be kind of helpful, as well as the options of other additional medications that we have training to do as well. I think really to find out what you're allergic to and get more additional treatments, and especially if it's kind of altering your quality of life, if you can't do the things that you're really loving to do, that would be another kind of reason why you want to see a specialist like an allergist, especially for allergies. But we see patients in more than just environmental allergies, so asthmatics, we also see patients with food, medication allergies. So it's a pretty broad disease population that we see. So any and whoever has any unexplained allergic reactions, things like that, along with the immune disorders or things with like repeated infections.
Right. Right. There's a lot to think about then. So if people are interested, how can they get in touch with you and how can they get more from the services at Beebe?
Yeah, so you can certainly, if you're in the Beebe system, put in a referral or just call for Beebe Allergy. And also you can just either, if you want an earlier appointment, you can also kind of give that urgency as well when you give that call. And we're located over at the Rehoboth campus in the Medical Arts Building, so right next to dermatology.
Fantastic. Well, I'm so glad you're here today. Thank you for educating us and for being there for all of us who keep the tissues on our desk and never know what we're allergic to. It's very helpful. Thank you.
Happy to be here.
Great. And don't forget, they see people of all ages. That is really so important and so unique to our area. So while I talk to her about what I can do to stop being allergic to my dogs, you can stay right where you are. We will be right back.
This segment of CoastLife was brought to you by Beebe Healthcare.